Constipation is one of the most common complaints among adults over 60, and the advice most people get is almost always the same: eat more fiber. That advice isn't wrong, but it's incomplete, and for a meaningful number of people, following it without addressing a second piece of the puzzle can actually make things worse, not better. That missing piece is hydration, and specifically how it interacts with fiber inside your colon. Let's walk through what's actually happening in your digestive system, why dehydration becomes more common and easier to miss after 60, and what the research says about fixing this properly rather than just adding more fiber to an already dry system. Why constipation becomes more common after 60. Before getting into hydration specifically, it helps to understand the broader picture. Several things shift with age that make constipation more likely. The muscles of the digestive tract can become somewhat less efficient at moving waste along. Physical activity often decreases. Certain medications commonly used by older adults have constipation as a side effect, and dietary patterns sometimes shift towards softer, more processed foods that are lower in fiber, particularly for people who have difficulty chewing. All of these are real contributing factors, and hydration is one piece of a bigger picture, not the entire explanation on its own. What actually happens in your colon when you're dehydrated? Here's the mechanism, in plain terms. As waste material moves through your large intestine, one of the colon's main jobs is to absorb water back into your body before the waste is eliminated. This is a normal, necessary process. But when your body is running low on fluid overall, the colon compensates by pulling out more water than usual from that waste material, in order to conserve fluid for the rest of your body. The result is stool that's harder, drier, and more difficult to pass. This is a well-documented physiological response, not a minor or occasional effect. When fluid intake is low, the colon absorbs more water from the stool, making it firmer and slower to move, which is a large part of why chronic mild dehydration and chronic constipation so often show up together. The part most people miss. Fiber and water work as a team, not separately. This is the detail that gets left out of a lot of generic advice, and it's the actual point of this video. Fiber's mechanism for relieving constipation depends heavily on water. Fiber works by absorbing fluid and adding bulk and softness to stool, which is what makes it easier for your body to move along. But that mechanism only works if there's enough fluid available for the fiber to absorb. When someone increases their fiber intake without also increasing their fluid intake, the fiber can't do its job properly, and in some cases the added fiber, without enough water alongside it, can become compacted, which may lead to more bloating, discomfort, and worse constipation rather than better. This is a genuinely common and underappreciated mistake, adding a fiber supplement or eating more high-fiber foods while inadvertently keeping fluid intake the same, expecting improvement, and instead feeling worse. It's also worth being straightforward about something the research shows. Fiber supplementation on its own has a more mixed track record, specifically in older adults than commonly assumed. A systematic review and meta-analysis of randomized controlled trials looking specifically at dietary fiber supplementation in elderly patients with chronic constipation found no statistically significant improvement in stool frequency across the studies analyzed. This doesn't mean fiber is useless. Fiber remains an important part of digestive health for many other reasons, and some specific types, like soluble fibers called fructans, have shown more consistent benefit for bowel movement frequency in other research. But it does mean fiber alone, without adequate hydration alongside it, is not the guaranteed fix that it's often presented as, particularly in older adults. Why dehydration is so easy to miss after 60. This is the part of the hydration piece that makes it a genuine blind spot rather than an obvious fix. As you age, the physiological signal that normally tells you, "I'm thirsty, drink something," becomes measurably less reliable. Research on aging and thirst regulation has consistently found that the sensation of thirst becomes dulled with age, meaning your body can be running a real fluid deficit without sending you the warning signal it used to rely on at a younger age. On top of that, several other age-related factors compound the problem. Kidney function naturally declines with age, with glomerular filtration rate, a measure of how efficiently your kidneys filter and manage fluid, decreasing by more than half between the ages of 30 and 80 in typical aging, which changes how your body manages fluid balance overall. Some medications commonly used by older adults, including certain diuretics, increase fluid loss. Reduced grip strength or mobility can make it physically harder to lift a full glass, carry a pitcher, or get up to refill a drink as often as needed. And some older adults deliberately limit their fluid intake out of a fear of urinary incontinence or difficulty getting to a bathroom in time. Not realizing this directly worsens constipation in the process. Research, bibliometric analyses, and clinical studies estimate that a substantial proportion of older adults are dehydrated at any given time, with rates considerably higher among those in long-term care or hospital settings than among healthy adults living independently. This is a genuinely under-recognized issue, not a rare edge case. Why a nighttime pattern specifically makes this worse. One pattern worth calling out directly. Many older adults deliberately reduce their fluid intake in the evening, specifically to avoid needing to use the bathroom overnight, which is an understandable and common strategy for improving sleep and reducing fall risk from nighttime trips to the bathroom. The problem is that if this evening fluid restriction isn't compensated for by adequate intake earlier in the day, it can contribute to an overall daily fluid deficit that shows up as harder stool and more difficulty in the morning. This isn't an argument against reducing fluids before bed for sleep or safety reasons. That's often a reasonable choice. It's a reason to be more deliberate about getting adequate fluid intake spread across the rest of the day, rather than cutting back overall. How much fluid the research actually points to. There isn't a single universal number that applies to everyone, since fluid needs vary by body size, activity level, climate, overall health, and diet. That said, general guidance for older adults commonly points to somewhere in the range of 6 to 8 cups of fluid a day, while broader adult guidance from health organizations often cites a range of roughly 1.5 to 2.5 liters, or about 6 to 10 cups, from both beverages and water-containing foods combined. Fluid doesn't have to come exclusively from plain water. Soup, fruits, vegetables, and other water-rich foods all count toward your total. If you're increasing fiber intake specifically, this becomes even more important. General guidance suggests aiming for roughly 25 to 38 grams of fiber a day, and pairing that with adequate fluid intake matters more, not less, as fiber intake goes up, since fiber without enough water is exactly the combination that can worsen symptoms. What actually helps based on the evidence? Based on the research, here's a more complete approach than just eat more fiber. Increase fluid intake gradually and spread it across the day, rather than trying to drink a large amount all at once, which is both harder on the bladder and less effective for hydration overall. If lifting a full glass is difficult due to grip strength, a smaller glass refilled more often, or a straw, can make this easier to sustain. Increase fiber and fluid together, not one without the other. If you're adding fiber-rich foods or a fiber supplement, increase your fluid intake at the same time, and increase fiber gradually rather than all at once, since a sudden large increase in fiber, even with adequate water, can cause bloating and gas as your digestive system adjusts. Don't rely on thirst as your signal. Since thirst sensation becomes less reliable with age, it's more effective to build fluid intake into a routine. A glass of water with each meal, a glass upon waking, a glass with any medication, rather than waiting to feel thirsty before drinking. Stay physically active where possible. Regular movement, even gentle activity like walking, helps stimulate normal bowel motility. General guidance suggests aiming for 150 to 300 minutes of moderate activity per week, which is also beneficial for many other aspects of health at this age. Establish a consistent bathroom routine and respond to the urge when it happens, rather than delaying, since regularly ignoring the urge to go can itself worsen chronic constipation over time. If you're limiting evening fluids for sleep or safety reasons, make sure you're compensating with adequate intake during the day, rather than simply running an overall lower daily total. When to talk to your doctor rather than self-treating. If constipation is severe, sudden in onset, accompanied by significant abdominal pain, blood in the stool, unexplained weight loss, or persists, despite reasonable changes to fluid and fiber intake, this is worth discussing with your doctor rather than continuing to self-manage, since these can sometimes signal something beyond ordinary age-related digestive changes. It's also worth reviewing your medication list with your doctor or pharmacist, since a number of common medications, including certain pain medications, iron supplements, and some blood pressure medications, list constipation as a known side effect, and there may be alternatives or adjustments worth discussing. And if you're considering a stool softener or laxative for ongoing use, that's a conversation to have with your doctor rather than a decision to make entirely on your own, since different products work through different mechanisms and aren't all appropriate for long-term daily use. The bottom line, constipation after 60 is rarely caused by just one thing, but hydration is a piece of the puzzle that's frequently overlooked. partly because thirst becomes a less reliable signal with age, and partly because most general advice focuses on fiber alone. Fiber and fluid work as a team. Fiber needs adequate water to do its job, and adding fiber without addressing hydration can sometimes make symptoms worse rather than better. Building consistent, spread-out fluid intake into your daily routine, alongside gradual increases in fiber and regular physical activity, is a more complete and evidence-supported approach than either piece on its own.